The carnivore diet consists of beef, chicken, lamb, mutton, pork, fish, eggs, and all kinds of seafood. Anything that comes from an animal product. It includes dairy as well, but be mindful of dairy, especially milk. I don't drink milk anymore. Milk has 47 grams of carbohydrates in a liter of milk. Milk can and will give some people inflammation, and inflammation can represent in the brain, in the skin, in the joints, and in the gut. Cheese is better, but it does have some carbohydrates in it. But some people do well with cheese, and they find it of benefit on the carnivore diet. Be mindful of cheese, not to overconsume it, because it might make you constipated, and it also has the risk of making you fat if you overuse cheese. The trouble with milk and with cheese is it can cause you to keep your cravings, your sweet cravings. You can prepare your meat in any way that you want. You can braai it, you can put it in a pan, you can put it in an oven, any way that you want to prepare the meat, but stay away from unsaturated seed oils such as sunflower or canola oil. Those kinds of oils will become trans fats when you heat them up, and it causes you to be more insulin resistant. Saturated plant oils such as olive oil is acceptable, but not the diluted kind, which is 90% sunflower oil. But it's better to cook with real butter. I sometimes use no butter at all, and I just put the meat in the pan. And not the plastic butter, not the butro or the margarine. Those are made from sunflower oil or from canola oil. Use real butter. Real butter has 0 carbohydrates in it. So you can also cook with palm oil, coconut oil. So with the carnivore diet, we don't consume any plant material at all. So we don't eat any starch, we don't eat any potatoes or sweet potatoes or any fruit or any vegetables. We also don't consume any grains on the carnivore diet. So we don't eat any bread or eat any pap or any cereals. We also don't eat any pasta or rice on the carnivore diet. You can drink coffee and you can drink tea, but without sweetener, without sugar. I drink bulletproof coffee nowadays. And so I make black coffee with real butter in it, and it helps me a lot. It gives me a lot of energy. Don't use any coffee creamers or tea creamers because they have plant material in them, as well as unsaturated seed oils. Don't drink any fruit juices. Don't drink any cold drinks. Even the zero type of cold drinks with the artificial sweetener in it is not allowed on the carnivore diet because it will keep your cravings and it will influence your insulin levels. It might not influence your glucose levels, but it still have an influence on your phallic phase. In other words, when you put the sweet taste in your mouth, your insulin will slightly go up, and also your sweet cravings will stay. And you make it difficult for yourself. The stricter you can be with your carnivore diet, the better you will do. Don't calorie restrict on the carnivore diet. Eat until you are not another bite full. Eat when you're hungry. Change your relationship with food. Many people see food as something social, something to lift them up. They have an emotional connotation to food. We as carnivores see food as an energy source. When you do that, you realize that food is energy. So eat when you're hungry, and eat until you're not another bite full. Don't cook with sugary sauces. Only use salt, in my opinion. I've got a video, Q22, on my frequently asked question playlist of which spices are allowed. But basically, single ingredient spices and the flake type, not the powdered type. But it's basically black pepper and garlic flakes. Don't use the powdered type, as it has gluten in it, which causes gut permeability, and there's also anti-caking agents in it. There is an adaptation phase when you start the carnivore diet. You can get keto flu. Keto flu, I've got a video on keto flu, but some of the symptoms is diarrhea, some of the symptoms is cramps, some people get headaches, but it's about 18 days. So there's an adaptation phase for your body to get fat adapted. If you struggle with uric acid, high uric acid levels, you can struggle a little bit more until you are fat adapted. I've got a video about how to get rid of your high uric acid levels with the carnivore diet. Check it out on my frequently asked question playlist. The carnivore diet is not a 2-week fix-it diet. You must look at the carnivore diet on a long-term perspective. It's a lifestyle. I know people that have been doing the carnivore diet for more than 12 years. So you can do it for a long time. All the nutrients that your body needs are found within animal products. I'm currently on the lion diet, which is a stricter form of the carnivore diet. It's only red meat and water and salt. I do add coffee and I do use butter. I feel butter helps me a lot. It's the fat part of dairy. Be patient with your progress on the carnivore diet. Your body will heal itself and you'll achieve your goals in time. Discuss the carnivore diet with your doctor before you begin it, because your doctor will have to help you to reduce your medicine as you progress with the carnivore diet. People reverse their type 2 diabetes within 7 days. So your blood glucose can drop quickly if you are using blood glucose medicine and you don't reduce it. You won't feel good. Same with hypertension medication, same with cholesterol medication. So you have to discuss it with your doctor before you do the carnivore diet, and you'll see that many people reverse their hypertension and type 2 diabetes and improve their cholesterol. Be mindful when you buy wors or sausage, since they have vegetable protein in it in most cases and added sugar as well as MSG. It's not good for you. For the same price you can buy real meat. If you will still consume alcohol on the carnivore diet, it can affect you quicker. And, of course, alcohol will affect your uric acid levels, especially beer. It's completely out. Don't use it. If you need to use alcohol, it would be better to use hard liquor, but without mixing it with cold drinks. With other words, use it on the rocks or with water, but it will absolutely hold you back. Alcohol will first be metabolized by your body before it metabolizes any food that you eat. So alcohol will influence your uric acid levels as well. So if your goal is to lose weight, consider not using alcohol on the carnivore diet. Biltong is fine, that is salted, but not spiced with sugary spices. Droewors is difficult because it normally has MSG and sugar-rich spices in it. Try to eat a little bit more fattier. If you are lethargic and you struggle with energy, add a little bit more fat. Even if you are constipated, adding more fat can help you. Don't worry if you can't eat a lot of fat at the moment. Your body will adapt and you'll be able to eat more fat later on.